If they are not willing to show up and make these things happen themselves, we'll make it happen for them. So here's how we're going to do things today, is that our guests are here to listen to you.
Okay. Well, my name is Jessica. It's awesome to see everybody. I'm unfortunately not getting paid to be here. Darn it. I actually go to the same church as Mr. Duffy, so I'm hoping to see him here, unfortunately. So I have two questions that are geared regarding the Affordable Care Act and health care in this country. I'm a registered nurse. I've been working my whole life. I pay my taxes. I pay a lot of taxes. I have no problem those taxes going to people that are less fortunate. But my question is geared to, one, pre-existing conditions. I have a daughter who was diagnosed with a brain tumor at 15. Turns out she was born with it. I didn't drink when I was pregnant. I didn't do drugs, but she was born with this congenital condition. I want to know how I'm going to keep her on my health insurance and keep her insured until she graduates college, so she can be successful and pay her taxes and give back to the community. My other question is regarding the travel ban. Up to 1/3 of our physicians in this country are foreign trained, and up to 15,000 are coming from the countries that are on the travel ban. So I want to know how we're going to address the already shortage of physicians in primary care to care for our senior citizens and the sick in this country, eliminating those foreign trained physicians and those 15,000 coming in from those countries.
So I'm Kay Grueling. I'm a family physician, and I have to leave for a board meeting shortly, and I have a bad respiratory infection, so I won't be able to talk long. But I'm frustrated on many levels with our senator and our congressman, and one is just even having access. I mean, I have not been able to get through, and I've called frequently about multiple issues, and the rare time that I've even gotten through, they're very condescending, and it's just amazing. I couldn't even walk into Congressman Duffy's office one day. They blocked the door. I'm like, seriously? I'm one person. And, I asked to come in. They're like, well, no, it's like a doctor's office. You decide who to let in. And I'm like, no, we let you come in and check in, and then you see us. So anyway, I'm very frustrated. But anyway, I'm very concerned just about so many issues, but I guess healthcare would embody a lot of them, because there are so many patients, as Jessica was mentioning, everywhere from primary care, which is largely in rural areas, provided by foreign-born providers, and many from the dark countries, so the people of brown skin color. And so we'll lose that, but also the Affordable Care Act that has made such a difference for so many people. And it's hadn't gone far enough, but it was the compromise to get us where we were supposed to be. And I really look forward to having improvements in it rather than them stripping all those things away that it currently provides.
Hello, I'm Don Oldenburg. And the reason why I'm here is I'm concerned about Social Security. I've been retired for 3 years, and I haven't gotten a pay raise in 3 years. And the little bit that they gave me this year went to Medicare increases. What my concern is, if the federal government owes $2.8 trillion to the trust fund, why do we have to increase retirement ages, and why do we have to reduce Social Security payments? The second part is, if we take the cap off of $118,500, that would fix it for the next 60 years.
Hi, I'm Pam Bannister. I've never been to a meeting like this.
Welcome.
I am not paid. I am not paid, and I'm really disgusted with both Representative Duffy and Senator Ron Johnson for not being able to show up here tonight. You work for all of us, and even though I haven't voted for you, you still represent my interest. Yes. And every morning I wake up and I'm upset about something new. There's bigotry, the ACA. I mean, how many civil rights can you peel back to people who are citizens of this country? When you call Mexicans rapists and murderers that come up from Mexico to live here, it does an injustice to an entire people that both senators have not stood up and said, this is wrong, and we are not going along with Mr. Trump. I hesitate to even call him a president because in my book, he's not. But the one thing I did want to talk about today was the rollbacks in the EPA and the Endangered Species Act. Everything else has me really ticked off, but those things are soul-crushing. We wake up some days and we can see eagles flying, mating eagles. And this is something that my children have the benefit of seeing. I never saw that when I was growing up. We didn't have an eagle. You know, these were things we saw in zoos. And it's a blessing to be able to look out the window and see a mating pair of eagle coming back this year again to roost. Do we have to go back to 1973? I wake up and I see coal is, the EPA's had some rollbacks in dumping into rivers for coal waste. This is ridiculous. We've come further than this, and I don't want to see it go back. So this is what is soul crushing to me.
Hi, I'm Nancy Kraft, and I'm from Russ County, and I'm here with my colleague Krissa Ostenso, and Krissa and I are both officers in the Russ County Democratic Party. And first of all, I want them to start doing their friggin' job. I get so frustrated. I have called their offices numerous times, and with Ron Johnson, his inbox, email inbox, or his phone inbox is full, and so it won't even accept a message in his Washington, D.C. office. And then I get this real corny recording when I call his Wisconsin office, and with Sean, it's the same thing. And when you talk to their staffers, you don't really get any good help. And then when they do write letters, they are so arrogant and they don't even respond to the issue. I called about Planned Parenthood and the defunding, and then I get a letter from Sean saying, thank you for supporting the defunding of Planned Parenthood. I mean, they don't even, it's just a travesty, especially after we had Dave Obey for years. So what a loss. But professionally, I am a grant writer for a community action agency. But I'm here personally representing myself, but I am really concerned. I read recently that they want to cut, the Trump administration is looking at making massive cuts. And one of the cuts they're looking at is to the Office on Violence Against Women. And that program supports about 27 different programs. And my community action agency and I have written a grant numerous times to that program, and we have received funding for legal assistance for victims of domestic violence, sexual assault, stalking, and dating violence, where my organization had 2 attorneys and was able to provide free legal services to low-income women who were victims of domestic violence and sexual assault. And we served over 1,000 women in the 5 years we had that fund. And we were in 15 counties providing that program, and now if they make this cut, who knows what's going to happen. And so I just really want to advocate that we need to keep these kind of government programs, and we need to keep the kind of government programs that support so many low-income individuals. I feel they're going to really get screwed under this administration, and it really concerns me. So.
I just did a count and there's 120, well now 123 people in here, not even counting myself.
They should cancel rooms on us more often, right?
Yeah.
Hi there, my name is Amy, and I just want to thank the woman that was just up here previously, because I do utilize those services and I don't want them to be cut. There are so many women out there that need them. I am here today, though, not for that. I just so happened to go after her. I'm here today for my son. His maltreater was charged with neglect, and Child Protective Services did not do anything to help protect him afterwards. I'm here to ask for reform on child welfare laws. Currently, I was told after my son was hit and run over by a truck and was on life support, I was told by Child Protective Services that we can only be reactive, not proactive. So 11 months prior, when his maltreater was educated on not leaving him on the side of a highway alone, that wasn't enough. And he was given back time and time again. He's back with him now, and I'm calling for one strike and you're out. Children's life should not be played with. This is not, we'll see if his maltreater learns. No, this is children. Don't play with their lives. I don't want my son's pain to be in vain, and I'm calling for reform on child welfare laws. Please. Not only did I report it and try to stop it from happening, but after I did, Child Protective Services was somehow able to turn it around on me, making me look like a bad mother. I was re-victimized in the hospital when I sat there crying when he was on life support, and in the report they called me hysterical. And this is what I've been dealing with, re-victimization. I go for help, and I should be getting help for the trauma that I saw my son go through, not because I was re-victimized by the services that were supposed to protect him. So thank you very much, and please think of the children.
Hello, I'm Dawn Garcia, and I have been in healthcare most of my life. And I am absolutely crushed to see what's happening with the ACA and the impact to lives in our communities. So I'd like to share some numbers with our representatives. At this point, as of January 31st, we had 242,863 people sign up on the healthcare exchange in Wisconsin. And if the repeal goes forward, we have a projected number of people who will lose that coverage at 165,052. Do the math, that's over half of the individuals who signed up will be losing coverage, and that coverage is going to impact those who are most in need. The GOP plan that was released as their initial proposal as of last Thursday indicates that coverage will be there for those who are in most dire need, but that's going to be at the will, if you will, of the state, if it goes forward. So that's going to depend on our local representatives and senators to really allocate some funds in ways that we won't have assurance of. So not only will we lose it potentially on the federal basis, but we will potentially lose more at the state level. Healthcare, preventative healthcare, is less expensive than illness care. When people don't have coverage, what happens is they end up in urgent care, emergency care, or unfortunately their health continues to deteriorate until they have no choice. And many people will die in Wisconsin if this goes forward. As an advocate for healthcare for our community and for doing what's right and what's most cost effective, I implore you to avoid the repeal, do not repeal, Make modifications of the ACA where it needs to happen. Tweak it where there are indications of need. There's been changes that we've learned, but please don't repeal something that's working for all of Wisconsin.
Yes.
My name is Lorraine Henning, and I'm from Eau Claire, Wisconsin. There's so many issues. I hope everybody addresses all of them. It was kind of hard to pick one thing to speak about, but the one thing that I do want to talk about, and this is directed toward you, Senator Johnson, the Republican administration is imposing very aggressive immigration policies. And this is a strong departure from the history of our country, from the welcoming attitude that we've had for immigrants since this country started. I'm wondering what is your position, Senator Johnson, on these policies? Who is to decide who's at risk? There's been talk about, well, we won't deport everybody, we'll just deport the bad guys. Who are the ones who are going to decide on this? As chair of the Homeland Security Committee, I urge you to schedule a hearing to investigate the human rights impact and also the economic cost of this drastic policy change. Thanks.
Hello, I'm Mary Beth Woodford, and I'm a constituent of both Duffy and Johnson, and I have not been paid to be here, but I do work at a free clinic in Wisconsin. And I want to talk about, before Affordable Care Act, we had lines around the block of patients waiting to get in to see us. We had to turn people away because we didn't have enough providers that night unless we went way into the next morning. We had to find places for people to get care if we weren't able to give it, and sometimes it was emergency rooms. Since then, our patient population has been cut almost in half. We have people who are younger that are on their parents' insurance and are able to be covered. We have those that had chronic disease treatment and medication caps or ceilings that are now able to get insurance to pay for that. And we have also had patients that left us that had pre-existing conditions, and now they have insurance that covers it. We can't go backwards. We can't stop the healthcare treatment. It's a basic right to all human beings, not an entitlement. And we also have compassionate physicians that come to our clinic to provide care at no cost. They do not get a paycheck for coming, and they are from other countries besides the United States. And we thank them every time for their compassionate care.
My name is Gene Hillman, and my wife told me I had to write these questions down, otherwise I'd talk too long. So I did. I'd like to ask Senator Johnson and Congressman Duffy 3 questions. First of all, do you support an independent, nonpartisan investigation of possible relationships and activities between Russia and Trump's campaign committee and/or the Trump administration? Second question, do you support maintaining Social Security and Medicare as it is? And the third one, is, are you willing to protect our economy from Wall Street?
Hello, my name is Krista Ostenso. We have a family business in, Ladysmith, Wisconsin. It's a business of optometry. So we have worked in the healthcare field for over 20 years there in Ladysmith. I just want to say that everything I've heard tonight in regard to immigration, in regard to protecting us from Wall Street, in regard to the absolute need for a complete and thorough investigation into any and all ties between our administration and big money, big oil, and Russia is a high priority. And then on the issue of healthcare, I'd like to tell my representatives that there really is not going to be a solution. Most people realize this. You're not going to have people paying less out of pocket and everyone getting the coverage they need regardless of any pre-existing conditions or, where they work or what have you. So it really is time for our country to just say that we all believe that everyone is entitled to health care. None of us would stand up and say, oh no, if you're sick, you can't have health care. There's no politician that would stand up there and say it. So it's time for us to pay for it through our taxes, like most every other reasonable country, and to have not only Medicare for all, but something even better than Medicare for all people.
This is from Dr. Bart Hobson, a local physician. He couldn't be here tonight. As you can imagine, he's a very busy individual, but he was really concerned that we asked this question, and he has really good insight considering he works with a lot of the folks here locally and works in the medical establishments. So.
He says, Mr. Duffy, you have repeatedly said you would provide a replacement for the Affordable Care Act, and now Republican congressmen are in a position to do so. Of the many aspects of health care, I would like to focus on one I know is important to you, maternity and newborn care. A proven health analytics review of maternal and newborn care, charges published in 2013, looked at charges and payments for such care in women with commercial insurance with Medicaid in 2010. Although there was variation among regions, in the United States, the average cost of a vaginal delivery and newborn care was $30,000, and for a cesarean delivery, $50,000. The cost of such care for your family's 8 children would therefore be $240,000 if costs did not change during the time your children were born. Were you able to pay this amount yourself, or was your insurance, commercial or governmental, responsible for all or part? Do you intend... Do you intend your replacement for the Affordable Care Act to provide coverage for childbirth to all American women? If so, how will your replacement provide this? If not, what would you advise doctors and hospitals to do with the women who do not have such coverage and do not have the ability to cover such costs personally? Thank you.
Thank you. You got a tough act to follow.
I sure do. I sure do. Hi, thank you. My name is Vicki Petrashik. I live in Prentice. I wish that Senator Johnson and Representative Duffy were here to see this beautiful group of real live constituents. It's real people. You can just tell if only they were here. I wanted to come. They're not.
They're going to see.
Good. I wanted to say tonight that in my entire life, I've always asked myself, what would I have done during the Holocaust? And it's always kind of haunted me. And the answer now is exactly what we're doing now. And so I feel like it's really important, and I'm so grateful for everybody who's here. I recently went to a brief town hall with Sean Duffy in Minocqua, and he proudly began that town hall with the Pledge of Allegiance. It said, "One nation under God with liberty and justice for all." And I guess I would really like to remind him of those words. The issue, as everyone has said tonight, we have a lot of issues. We have a lot of things in our heart. But for me right now, the immigrants and the refugees are just a heart-tearing issue. I look at the children of those immigrants and the fact that they wake up every day traumatized. We can't fix that later. We have to fix that now.